I think the really important thing is to talk about system building within other systems that we already have in place. And I think the reason for that is because home visiting is an amazing example of a policy area where we can use issue advocacy to really bridge the gap between early care and education and perinatal and children's health. So before our home visiting campaign was established in Pennsylvania, which is called Childhood Begins at Home, in 2017, before that occurred, Pennsylvania had a couple really strong education campaigns for early care and education, so childcare and pre-K. And Pennsylvania Partnerships for Children was a principal member of both of those campaigns before we got involved in home visiting. But after our home visiting coalition was established, we were able to utilize the work that we had done in those other campaigns to see the linkages that occur daily within home visiting. That helped us leverage that campaign overlap for policy development and to appeal to policymakers. So we see the intersections between early care and education, home visiting, perinatal and children's health, and we were able to run with those and really make those the cornerstone of our work. Now, more recently in 2021, we built off the success of Childhood Begins at Home, and we launched our perinatal and children's health campaign that's called Thriving PA that we're very proud of. And in that work, I think we really learned that home visiting is a keystone of our broader work effort across campaigns because it has anchors in both early care and education and perinatal and children's health. And the work that we've done there has shown that our success can be achieved when we highlight the intersections of that work. And we're really working hard because we know that system building is important and we need to broaden service delivery systems because the most important folks, the people that need the most help in Pennsylvania, pregnant women, young children, and families need a broad array of supports and services. And we really think that by working within our campaigns and broadening our advocacy work, we can really enhance those services and get folks help they need.
So Idaho Voices for Children kind of was faced with this this reality a handful of years ago at this point, where we needed to identify some kind of advocate in the state that would address the significant sort of foster care and child welfare needs from the advocacy perspective in the state house. But sort of our agreement internally to ourselves is we weren't going to work on strengthening the foster care system without also, which is, sort of implicitly acknowledging abuse and neglect, without also investing in policy that would strengthen families. And so this was sort of the deal that we made to ourselves, that we would work on the foster care system as long as we pursued another program. And that program, just in terms of policy viability, turned out to be home visiting.
But as more and more people started paying attention to the first 3 years of life, we really made sure that we talked about family home visiting as one of the services in which we're voluntarily available to families, along with other early childhood services. And we've always tried to work in that bigger umbrella of what families need in those first 3 years of life. So we have many of our stakeholders and partners are also supporting childcare or talking about child welfare, and this as part of that continuum, that not every family may need it or want it, but it's available to families that do. So our coalition over time diversified in who comes to the table to support family home visiting services.